If you were a physician or a nurse practitioner and you are thinking about going into aesthetic medicine, or you started practicing aesthetic medicine, or you may have been doing aesthetic medicine for a while now, and what you've probably realized is that at times it's not really as easy as you thought it might have been. And the frustration that I hear from many doctors practicing in this field is that although there is a lot of money coming through, the margins are getting smaller and smaller. So we're having to deal with the laser companies and the manufacturers of fillers and neurotoxins raising their prices constantly. At the same time, competition is getting tough, and your competition is lowering prices, and in order to keep up, you may be finding that you're having to lower prices as well to keep up with the competition, and your margins are getting smaller. And it's hard to keep a business open of this kind because the overhead is extremely high. And you know about staffing and cost of malpractice insurance, cost of materials, and of course marketing. Marketing is a huge expense, and that's something that our colleagues in the medical side of this don't really have to deal with, because if you're accepting insurance, you're getting your clients or patients from your insurance companies. When you're doing aesthetic medicine, marketing is a huge part of your practice and a huge expense. So I've been practicing aesthetic medicine for about 10 years now, and like many of you, I started off in another field of medicine. I practiced internal medicine for 15 years before I made the switch into aesthetic medicine. And when I started practicing aesthetic medicine, we didn't really have what they call non-core physicians practicing. So it was a little tough for me to compete with the plastic surgeons, the dermatologists, and other professionals who have been kind of niched into this field. So now the landscape has changed completely. There are many non-physicians practicing because in some states they're allowed to. And there are many people who are practicing who don't even have proper training, and their business model is to undercut you by running Groupons and living social deals and bargains and parties where they are their main focus is to get people in with low prices. That can work for a little while, but that model really is not a sustainable model, because in order to compete on price, you're going to have to cut corners. And when you start cutting corners, you are going to start having bad results. You're going to start having infections and bad reviews, things that you really don't want to deal with. And honestly, if you're competing on price, there is only one person who's going to have the lowest price. And do you really want to be the winner in that game by being the lowest price provider? I'm here today to talk to you about a different way. And the way that I've found to build my practice from a very small practice on the side to a 100% aesthetic practice is to focus on quality, focus on providing treatments that no one else is doing, and most importantly, to get results that none of my competitors are able to deliver. And what I've done in conjunction with some of my affiliates is to come up with a training program to try to teach you some of the techniques and treatments that we've found to have the best results with the most patient satisfaction, and more importantly for the bottom line is with a good margin where you are being paid for your skills and not the products that you're delivering. So one of the treatments that is really popular right now is platelet-rich plasma, PRP. And I've teamed up with Dr. Charles Runnels, who is the founder of the Vampire brand of PRP treatments. And I'm now an official trainer for Dr. Runnels in the Vampire techniques. So the Vampire techniques are treatments utilizing platelet-rich plasma, which many of us are probably already using. But the importance of the Vampire brand is that people recognize the brand, and they know that when they go to an official authorized Vampire provider that they are going to get a consistent quality of treatment, and they know that the provider is properly trained and part of a network of physicians, nurses, dentists, or other providers who are keeping each other in check and teaching each other to fine-tune and constantly improve on their techniques. So what I want to do is now tell you about the course that I'm teaching. So I've been teaching platelet-rich plasma for quite some time now, and we've been teaching different procedures like the microneedling with the platelet-rich plasma. We've been teaching hair restoration. We've been teaching PRP for pain management, and there are a lot of different uses. And now teaming up with Dr. Runnels and teaching the Vampire procedure allows me to teach you how to do the specific technique that Dr. Runnels uses for his Vampire brand of treatments. And with this training, you will also have the opportunity to join the network and use that brand as well. As you may know or you may not know, the Vampire brand is a trademark brand, so you cannot use that brand if you're not an authorized provider. And what we're going to do is to help you become a part of this network so that that you can use that brand too and be part of this network. So what I want you to do is to read through the description of this course and see if this is right for you. What's included is there's two parts. The first part is the PRP training. So you will learn all about platelet-rich plasma, how it works, how it can be used, and you're going to learn some simple techniques to start using PRP right away in your practice to get an edge over your competition. The second part of this program is teaching the specific Vampire techniques. So this includes the Vampire Facial, the Vampire Facelift, the Vampire Breast Lift, the O-Shot, P-Shot, as well as some of the other techniques that I've incorporated into this, in like using PRP with some of the laser devices and radio frequency devices that you may have lying around in your office. You may have a radio frequency device that you bought hoping that it would be a great way to create skin tightening non-invasively, and then realized it wasn't working quite as well as you had hoped, and now it's sitting in the corner collecting dust. I'm going to show you how you can revive those machines and make them profitable for you by combining them with PRP treatments. We're also going to teach you marketing. Marketing is key because most of us coming from the medical side do not have much experience in marketing, and believe me, marketing is going to be what makes or breaks your practice. And you can market in a smart way, and it's going to cost you very little, or you can blow tens of thousands of dollars a month on marketing without getting the return that you're hoping for. So if you're interested in this training, I want you to read the descriptions below and do sign up. You can sign up for the 1-day course or the 2-day course. With the 2-day course, you will get a complete hands-on training so that you will be able to go back and start utilizing all these treatments, including all of the vampire treatments right away. And you will get a 3-month membership to the Vampire Network so that you will have access to all of our training videos, marketing material, and you can use the Vampire brand for 3 months. And that's almost a $1,000 value there, and we are giving that to you as part of this course. And the training that we are providing comes with support from myself, and as if you join the Vampire Cellular Medicine Network, you will have access to all of Dr. Reynolds' materials as well. So thank you for listening, and we hope to see you at our next training.